everyone, welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what we have from the world of medicine. The diets that are responsible for tumor progression and growth. Researchers have recently discussed the role that certain nutrients can have on tumor development. Now, this was analyzed along with the most recent data justifying the idea that the prescription of physical exercise should not be optional, but rather it should be integrated into the oncological treatment. Now, both diet and lifestyle can have an influence on each of the successive stages that occur in the carcinogenesis processes, that is the initiation, promotion, and even the progression phase. Although nutritional factors and factors that are related to daily eating habits are more or less the same, the impact of these at each phase of this is very different. A deficit of certain nutrients is one of the nutritional factors that are involved in the initiation phase, including folate and B group of vitamins, which leads to chromosomal ruptures, DNA hypomethylation, and also increased sensitivity to mutagens. As for vitamin C and selenium deficiency, this increases the oxidative DNA damage, an effect that is also associated with inadequate levels of zinc and magnesium as well as vitamin D deficiency. Now, alpha toxin had a negative impact in the initiation phase and it is present in foods of vegetable origin such as cassava, pepper, corn, millet, rice, sorghum, wheat, sunflower seeds or peanuts, although its effect largely depends on the way in which these foods are stored. The specialist stated that there are two particularly harmful type of processed foods. One is cured meat and the other smoked meat and fish, which contains polycyclic aromatic hydrocarbons, chemical substances that are directly related with certain cooking methods. The study also highlighted that it is possible to reduce the formation of these substances using various strategies. One strategy is by marinating the food in an acid solution for more than an hour, since through this the formation of these hydrocarbons is markedly reduced, which should be included in the diet of any cancer patient along with the oncological treatment that they are undergoing. Ways to predict the severity of COVID-19. Inflammatory responses in COVID-19 is responsible for acute respiratory distress syndrome and multiple organ failure and plays a major role in the morbidity and mortality of patients. A present study in the Journal of the Associations of Physicians of India assessed the serum levels of cytokines and its association with other inflammatory markers, as well as studied this association with the disease severity in COVID-19 and hence their prognostic significance. This was a retrospective observational study of 175 admitted COVID-19 patients. The patients' clinical data, lab investigations, inflammatory markers, as well as the serum levels of cytokines were all extracted. All the patients were divided into three groups. Group A had asymptomatic patients, Group B were divided into mild to moderately ill patients, and Group C had severe or critically ill patients. It was found that 55% of the patients were asymptomatic, 24% had mild to moderate illness, while the remaining 21% had severe or critical illness. Fever, cough, dyspnea, and comorbidities including hypertension and diabetes were very common in Group C. The absolute lymphocyte count, lymphocyte monocyte ratio also showed a decreasing trend, whereas the absolute neutrophil count and the neutrophil lymphocyte ratio, platelet lymphocyte ratio, and the eosinophil lymphocyte ratio showed an increasing trend with an increase in the disease severity. Also, the serum interleukin 6 was found to be significantly higher in Group C as compared to Groups A and B. Hence, the researchers concluded that the elevated IL-6 levels led to adverse clinical effects, so IL-6 level might serve as a potential prognostic marker for the severity of disease in COVID-19. Inhibition of this IL-6 marker might be helpful to prevent serious adverse events in COVID-19 infections. Vascular complications in the eye that is caused by diabetes mellitus. Diabetes-induced retinopathy mostly precedes nephropathy in patients with type 1 diabetes. However, this particular sequence is not consistent in patients with type 2 diabetes and has significant discordance. An observational cross-sectional study published in the Journal of the Associations of Physicians of India found a relationship between retinopathy and nephropathy in type 2 diabetic patients. It was seen that patients with type 2 diabetes did not have diabetic nephropathy always. It was a hospital-based prospective study that was conducted at the Indira Gandhi Medical College, Shimla. 141 patients with type 2 diabetes, that is 83 males and 58 females, were recruited in the study. The mean HbA1c of the study was 9. It was found that 56% of the patients in the study had the HbA1c levels more than 9%, while 27.7% had this value between 7 to 9, and only 16.3% of these patients had this level less than 7. Out of the total of 141 patients, diabetic kidney disease was present in 47.5% patients, and 33 had diabetic retinopathy. Hence, it was recorded that the relationship between retinopathy and nephropathy in type 2 diabetes patients is not as clear as in case of type 1 diabetes, and patients with type 2 diabetes conditions do not have diabetic nephropathy always, and non-diabetic renal disease is also quite common. The absence of retinopathy, rapid progression diabetes, the presence of RBCs are some of the atypical findings, and patients presenting with them should be subjected to renal biopsy to rule out any non-diabetic renal disease. The occurrence of obstructive sleep apnea in patients with respiratory disorders. Obstructive sleep apnea is commonly found in interstitial lung disorders, with overall incidence varying from 17 to 88%. The morbidity and mortality of this condition are high when it occurs with chronic respiratory diseases like interstitial lung disease itself. Now, there is a lack of data on sleep breathing disorders in such conditions, and specifically all this data is lacking in India. The present study in the Journal of the Associations of Physicians of India, it aimed to assess the occurrence of this obstructive sleep apnea in interstitial lung disease patients and also study its correlation with various other parameters. The study was a prospective observational study of 41 interstitial lung disease patients of the duration of 1 year. All patients underwent detailed clinical examinations, radiological investigations, lab investigations, and also type 1 diagnostic polysomnography according to the American Academy of Sleep Medicine guidelines. The severity of the obstructive sleep apnea was defined as per the apnea-hypopnea index, and the correlation of obstructive sleep apnea with other parameters, as I previously mentioned, were all assessed. It was found that dyspnea and cough were the most common symptoms. The most common type of interstitial lung disorder was hypersensitivity pneumonitis, accounting for 46.3%. The common findings were they had ground glass opacities and fibrosis. The obstructive sleep apnea was seen in 78% of these patients. The apnea-hypopnea index showed significant positive correlation with body mass index and the oxygen desaturation index. Hence, it was said that the prevalence of obstructive sleep apnea is common in North Indian interstitial lung disease patients. It was therefore concluded that the polysomnography should be done in all the patients with interstitial lung diseases, wherever it is feasible for an early diagnosis as well as for treatment of obstructive sleep apnea, as the coexisting of both will further decrease the quality of life and also increase the morbidity in this chronic progressive lung disease. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.